All right, guys, this is week 3, part 2. We're continuing our safety and compliance lectures. This is the N95 respirator mask. All right, this is specially fitted by Employee Health. We use this when we're going in isolation rooms for like TB, chicken pox, those kinds of things. Okay, it's different than your regular mask that you put on. It's specially fitted. You're given a number. Do not go into a room if you do not have if you don't know your number, if they don't have your number mask. This is making sure that nothing is getting through, and tuberculosis is not something you want to pick up from work. Okay. All right, isolation procedures. You need to know that they are designed to keep patients with communicable infections separate from each other's. Communicable, that means it spreads easily from one person to another. It's designed to prevent the spread of infection, protect patients with a compromised immune system. Isolation does require doctor's order, and the infected patient is confined to a private room. You need to know that, okay? All those points about isolation procedures. This is where we talk about also the pants being 1 to 1.5 inches off the floor to prevent contamination. All right, you need to know reverse isolation or protective isolation is for patients highly susceptible for infections. So think about a burn victim or patient, a cancer patient. We may put on our protective gear because their immune system can not handle what we're bringing in from the outside, okay? So reverse isolation is to protect the patients from us, not us from the patients, which is normally how it goes, okay? Universal or standard precautions. This is treating all blood and body fluids of all people as potentially infectious. We do not make a determination. We just assume everybody and every fluid that comes out of someone's body is infectious. Standard precautions is used for all patients. It's the number one strategy for control of HAIs or healthcare associated infections. We used to call them nosocomial. It covers blood, all body fluids, skin breaks, and mucous membranes. Okay. We have transmission-based precautions. These are used for patients with a known or suspected to have certain infections. We have 3 types: airborne, contact, and droplet. All right, biohazard is any material or substance harmful to your health. These should be identified by a biohazard label, okay? Biohazard exposure routes. They can be airborne, ingestion, non-intact skin, percutaneous, or through the skin. You need to know that. Pure mucosal, or through the mucous membranes. You need to know that term, okay? Blood-borne pathogens. We have our hepatitis. Our best defense against Hep B is the Hep B vaccination. This is the one that everybody in healthcare, we make sure you have an immunity to Hep B, okay? It's present in blood and other body fluids. It can survive up to 7 days in dried blood on an object, okay? It's transmitted via needle sticks or shared needles, okay? Hep C is another. It's present in blood and serum, sometimes saliva. An infection occurs after multiple or large exposures. It can be needle stick, sexual contact. You need to know the symptoms. OSHA, standard for bloodborne pathogens, is enforced by federal law. It's intended to reduce or eliminate occupational exposure to bloodborne pathogens. It's done by engineering and work practice controls to prevent exposure to incidents, needle safety, those kind of things is what it's talking about. Special training, medical surveillance, and availability of vaccination against Hep B for all at-risk personnel. That is the OSHA bloodborne pathogen standard. Bloodborne pathogen exposure routes. Skin is pierced by a contaminated needle or sharp object. Blood or other body fluid, it splashes in your eyes, nose, or mouth. Blood or other body fluid comes in contact with a cut, scratch, or abrasion, or a human bite breaks the skin. Needle, stick, or sharps injuries. So you would carefully remove the shards of glass or other objects, wash the site with soap and water for at least 30 seconds, and then you're going to report the incident. Now, if you have a contact with the body fluid in your mucous membranes, you're going to flush the site with water or sterile saline for at least 10 minutes. Use an eye wash station if you have that available to flush your eyes. Remove contact lenses as soon as possible and throw them away. Do not disinfect them. Throw them away. Don't put them back in your eyes. Report the incident immediately to your supervisor, and then you would report to employee health or wherever your facility wants you to report for evaluation, treatment, and counseling. Surface decontamination is required by OSHA. All surfaces and specimen collection processing areas should be disinfected. We use a 1 to 10 bleach solution or other disinfectant approved by the EPA. So 1 to 10 bleach, that'd be like if you are making the solution, 1 ounce of bleach to 10 ounces of water is what that means, okay? Biohazard waste disposal. All non-reusable items contaminated with blood or body fluids go in biohazard waste containers. That is if they're saturated, okay? Electrical safety. So if an electrical shock occurs, we're going to shut off the source of electricity, use a non-conducting item to remove the source of electricity from the victim, call for medical assistance, start CPR if needed, and keep the victim warm. We are not going to use an IV pole to take someone off an electrical shock, right? We're going to use non-conducting, so like a broom handle, something plastic or wood. All employees should know fire safety procedures, okay? You need to know the location of fire extinguishers, how to use them, fire blankets, heavy towels, and how to use them, and the location of emergency routes and exits, okay? You need to know the components needed for a fire to occur. You need a combustible material, heat that raises the temperature to the point of ignition, oxygen to maintain combustion, and a chemical reaction which produces the fire. Don't need to worry about this fire. Tetrahedron. That was taken out. All right, you do need to know fire safety. All right, you need to know Class A fires are combustible materials like wood and paper. You need to know that Class B fires are flammable liquids and vapors like paint, oil, grease, and gasoline. You do not need to know how to smother them, but you do need to know the different classes and what those materials are. Class D is combustible or reactive materials like sodium, potassium, magnesium, lithium. Class K is high temperature cooking oils, grease, or fats. If you're working in the lab and you have these materials in your lab, you need to be familiar with your safety manual and how to clean up spills or incidents with those materials, okay? Chemical safety. Always wear PPE and clean up chemical spills properly. We never store chemicals above eye level. We add water to acid, not acid to water. We don't just mix chemicals together because we want to. We store chemicals we don't store chemicals in unlabeled containers or pour chemicals into dirty containers or use chemicals in ways that they were not intended, okay? Safety showers. You should know the location, their use of these showers in the lab. They're used for chemical spills, splashes to the eyes or body. You would stand in the shower for 15 minutes, probably with no clothes on, and they're in the middle of the lab. Let's just be safe with our chemicals, okay? All right, this is an example of a chemical spill kit. So whatever chemical was spilled, you would go look in your safety manual. It would tell you what kit to use, how to clean it up, and then you would use it exactly as directed, okay? We don't want to show up to the ER for a preventable mistake, okay? External hemorrhage. This is an abnormal or profuse bleeding. The best way to combat this is firm, direct pressure to the wound using cloth or gauze. I will say it is important to maybe use sterile saline, If you don't have that available, some water out of a water bottle on the cloth or gauze, because what happens if you have a big wound, right, and the blood is going to start clotting, it's going to stick to the cloth, and by the time you get to the ER and they pull that cloth back, they're going to pull the clot and it's going to start bleeding again, okay? An elastic bandage can be used to hold a compress in place, and we only use tourniquets to cut off the blood supply as a last resort, because that means you are probably going to lose that limb. Tourniquets, the movies say, like, they put a tourniquet on, you're not saving the leg, okay, or the arm. The original compress should never be removed because it will disrupt the clotting process. You would just add more to it. Now, if it got to the point, where you're adding so much, you're not getting a good compress, so you're going to not take off the original, but you're going to take off those other layers and put fresh layers on there. I have been walking out to my car from a shift at work, 12-hour shift, and someone was bleeding, like their hand was split open, and they were like freaking out a little bit. So I grabbed their hand and took them inside and stayed with them another hour till they got stable, and taken care of. Because every time I took my hand off, the bleeding started pouring everywhere. So, firm, direct pressure works. And it's so simple. All right, shock is insufficient return of blood to the heart. It's an inadequate supply of oxygen to the body and tissues. It can cause by hemorrhage, heart attack, trauma, and drug reactions. Our symptoms are pale, cold, clammy skin, rapid, weak pulse, increased shallow breathing rate, and expressionless face, staring eyes. How do we treat this? We're going to maintain an open airway, call for assistance, keep the victim laying down with their head lower than the rest of their body. We're going to control the external factor, whatever is causing the shock if we can, and keep the victim warm until help arrives. CPR, immediate recognition of cardiac arrest and activation of the emergency response system, and an emphasis on chest compressions is what I want you guys to remember about this slide. You all will have CPR at some point in your career that will go much better than what we need to know for this class, okay? Personal wellness is not just about what you eat. It requires a holistic approach that meets the physical, emotional, social, spiritual, and economic needs of you. You cannot help anyone else if you are depleted. You have to make sure that you are at your optimal in all areas of your life so that you can give quality care and enjoy your job. Okay? I'll see you in the next part.